Hello everyone, my name is Veronica Nieto-Diaz. I am a PTA and program director here at a program in South Florida, and I am here to cover a lesson on effective strategies for studying for the licensure exam. Of course, since I am a PTA and I direct a PTA program, this will be based on the PTA exam, the NPTAE as it is known. But if you are a DPT student or PT student, or really studying any high stakes exam, this could be helpful for you either way. While I am a PTA, I do have a bachelor's in health science and a master's in education. So, I am very well versed in just the years of experience I have, not only teaching my patients, but teaching students, and have that background in education and teaching to try to help with this specific course of, part of a lot of healthcare programs where they have to take exams. So first, let's talk about this exam, the NPTAE. In physical therapy assistant school or physical therapy school, DPT school, at the end, you're going to have to finish your program and take a high stakes exam known as the NPTE or NPTAE. This is, the second half or the second roadblock obstacle, if you will, that our students have to face, because the first part is getting through our exams in the program, but in the end, putting it all together for this exam, right? Like I said, any healthcare program, or most healthcare programs, especially if you get licensed, nursing, respiratory therapy, even surgical tech, occupational therapy, they have some type of board, as we call it. We like to call it the boards, right? So, of course, we're talking about the physical therapy based one. And in the specific PTA exam, the FSBPT, which is the Federation of State Boards of Physical Therapy, who create all the exams for both the PTs, the DPTs, and the PTAs, they have this thing called a content outline on their site. And it basically breaks down the exam question per question almost, in what's going to be on there so that you have an idea. Of course, it doesn't give you the exact questions, but they literally do tell you. If you look at like the first line on this picture that's displayed on the screen, there's going to be about 20, it says 20 to 27 questions on cardio and pulmonary systems. And out of those 20 to 27, 5 to 8 are data collection, 7 to 9, I think it says, are diseases and conditions, and 8 to 10 are interventions. So they get pretty specific with how to break it down, right? While my presentation is blocking the bottom part and the numbers, you can always find this outline on the FSBPT website. If you just Google FSBPT content outline, PTA exam or something like that, or you go to that site and they also have like a little search bar and you look for the content outline. Just make sure you're picking the right exam. If you're a PTA, that you're picking the PTA one, and if you're a DPT, that you're picking the PT one. But they'll give you this breakdown, and when it gets updated year by year, they will update it. So they give you a pretty good breakdown of what you can expect. And students usually come out of the exam feeling like, my exam was only neuro, my exam was only peds. But that's never true. They're very strict and rigorous on making this public and making sure they adhere, that it has all these topics and that it's broken down in that way to give you this outline so that it could be transparent. It just feels like that to students because maybe that's the questions that they remember most, or they were more like scared of those questions or surprised by those questions. So that's why they feel like that. Also, students sometimes have a hard time understanding the way because I am an item writer myself. So when I say we, I'm even speaking personally as somebody who has written for the boards on how we categorize things, right? If I write a question that says, your patient has had a stroke, had a CVA, and they have weakness on the anterior tibialis, what type of e-stim and what parameters would be best for this patient? Is it NMES with 500 pulse frequency? Is it high volt with 100 pulse frequency, etc., etc.? While in the beginning, when I started that question, it sounded like a neuro question, it is not a neuro question. It's actually a non-systems modalities question, right? So when students are reading that, they'll be like, everything was neuro, everything was neuro. But sometimes we put in a little prompt about a patient to try to just make it more realistic to how you would apply it real life. But it's not an actual neuro question or cardio question. It's something else, and then that's probably why students feel like that too. Like my exam only had this, my exam only had that, right? If you look at the breakdown though, it adds up to 140. And in the PTA exam, at least, 140 are what you're being scored on and what's going to get your final score. And you can also look at the breakdown of body systems and notice that cardiovascular, musculoskeletal, and nervous system are the ones that have the most questions, which is what we call the big three. But the other systems are there too, so we can't forget about those. And then even those body systems don't add up to 140, right? Those body systems add up to about 100-ish. The bottom part that says non-systems is the other 30 to 40 questions, okay? So what happens is sometimes students get so stuck on looking at the body systems, the pathologies and the protocols, and they forget about the non-system stuff that could give them a good half of their points that they could easily get, like modalities like safety and protection, CPR, infection control, professional responsibilities. If your patient needs a referral to psych or something, who do you tell? How's that process like? Equipment, devices, and technology. What orthotic is best? What prosthetic is best? What wheelchair is good for that patient? What assistive device? So it's easy to forget to study those, but those can be an easy point if you study them and if you remember those basics. A lot of the times, those are the things that you learn first in a PT or PTA program, and they're easily forgotten if you don't look back on them. And then students get so focused again on studying about the big three, and they forget about these other things that could be easy things to review and relearn. You just didn't study them, so don't forget about those other ones as well, because those are important. And really don't skip any of the systems just because the big three are the biggest, right? It does not mean that we don't study integumentary, that we don't study metabolic or endocrine, gastrointestinal, because in the end, you want to give yourself the best chance to get a good score, a passing score. And that means that you want to take from everything. There's 31 to 40 MS questions. If you got 100% of them right, you would be on a good track. But chances are you're not going to get 100% of them right. If you ever look at a breakdown, maybe take some mock boards or look at other people's mocks and look at the breakdown. No section ever says I got 100% on this section. Because these exams are made to be hard. So you shouldn't be counting on just studying the big three and being like, if I get 100% on these questions, then I'll pass the exam. You're not going to get 100% on any question, on any section. So you should be studying everything so that they can all add up to a good score. And you do need about 100 correct out of the 140, and you want to take a little bit from everything. So now we're going to go through the exam a little bit more in detail, looking at the types of questions that are on the exam, the duration of the exam, and then what it means to score 600. What are we actually saying about that? What does that mean? So the first thing to understand is that a lot of the high stake exams, but specifically the NPTAE, is 140 scored multiple choice questions. Okay, there is no write-in, there is no essay. They do have videos, they do have case studies, but there's still going to be a choice when you're looking at the video or when you're looking at the case study of a question that has 1, 2, 3, 4, and you have to pick the best. Okay. When I say 140 scored is because the exam has 180 questions, but 40 of those are not scored and the other 140 are scored. You as the reader do not know which ones are not scored. There's no signal, there's no star, there's no this section is not scored. None of that. They're all mixed in together. You could have a section of 50 or 45 questions that 5 of them could be not scored and the other 40 could be scored, and they're not going to tell you which ones those are. You just have to answer every question going in like, can I answer that or not? Or should I, I have to get this point, so I have to answer it. The reason why the FSBPT does that is because in order to have a continuous bank of questions to change the exams and have different versions and have different ones year by year, to retire some exams, is they need constant questions, right? So they ask item writers like myself to write questions, and before they officially put it on the exam, they will put it on the exam in an unofficial way as a non-scored item and see how students interact with that question. They'll see, is it too easy? Is it too hard? Or is it just right where we think we could put it? Does it make sense for what students are learning? If it's too hard, then they probably feel like they shouldn't put it on the exam because students are not learning this in that way, or it's just too hard to figure out. If it's too easy, they also may not put it on a future exam because maybe it's just too simple, or they'll put it on a future exam, but they'll make it worth less points, right? And then when it's just right, they know it's just right, and then they'll include it in the future, in a future exam as a scored item. But in this moment, it's non-scored, so you don't know what that is. So 140 scored, multiple choice, okay? Again, that means you have a choice. You have one correct answer. And they try to be very fair and specific that you can discuss or you can rationalize why the correct answer is the correct answer. And there is only one, okay? A lot of times it's about a word or something specific you have to notice that will let you know that this is the best answer. This is the most correct, okay? So in order to do that, you have to know kind of those strategies to handle multiple choice questions, okay? The first thing you want to do when you target a multiple choice question is you want to read it, the question part, the part with the question mark, and you really want to see what action are they trying to tell me to take. Am I choosing an intervention? Am I choosing a pathology? Am I choosing something the PTA should do, or am I choosing something the patient needs to do, or somebody else needs to do, the nurse needs to do, so that you can understand when you're looking at the choices what makes sense. Because if you think the question is asking about what the PTA should do, but the question is really asking what the patient should do, and then there's choices in the bottom that are more related to what the PTA should do, then you know those cannot be it, because the patient wouldn't do that. The PTA would do that, right? So that's how you can start kind of cutting your choices, okay? The second thing you want to do is reread that, and now that you understood the action, think about what key words are in that question. Is it about a specific type of patient? Do they have a certain balance that you need to take into consideration, or a certain age or gender, or something that you have to notice in that stem is what we call it, right? And other little words like initial or least, picking the least question or the least choice instead of the best choice. A lot of times the questions are the best, but sometimes they'll throw in a least, and you have to notice that it says least. Or, again, what should you do after this happens? So like now it's like I would do this first, but after that, what's the next step? So you really want to pay attention to what keywords are in there. Maybe write them down, maybe highlight them, underline them, whatever you can do. Then you want to not even look at your choices yet and come up with an answer in your head, because these tests are made with what we call distractors, right? Literally, the right choice is called the correct choice, and the other 3 choices are called distractors. They are made by us to distract you, okay? So if you already come up with something in your head, you will be least distracted by those other choices. Sometimes we pick one out and then we look at the choices and then we're like, I don't know, wait, now I'm not sure. And that's because you're getting distracted, and that's the point, okay? So try to come up with the best choice in your brain without even looking at the questions, and see if it's there. And if it's there, put it in high regard. Be like, I'm gonna stick with this, and I'm just gonna look at each choice to really, really make sure. But if I'm not sure, this is the one I'm going with. And put that one at the highest level of hierarchy of being the correct one, okay? Then you look at the other choices just to make sure. If you are looking at the other choices and nothing in the other choices is really catching your eye, you're like, well, maybe it could be this, it could be that, I'm not sure, but this like you're kind of questioning things but you're not sure, then just go with your first choice, okay? If you catch a keyword or something in the other choices that made it a better choice than what you had in your head, then pick that one. But if you're not sure, stick with the one you came up with, okay? Sometimes when we try to come up with choices in our head, it's not there in the 4 choices, right? Like if they say, what is the best intervention to strengthen the bicep? I don't know. I mean, you can come up with 1,000 interventions. So maybe the one you came up with your head, bicep curls with a weight, that's not there. They give you 4 other choices of how to strengthen the bicep, but not that one. Then you have to you have to kind of put away what you thought of at first, and you have to look at the actual choices and try to pick the best one from what you have and eliminate as much as you can, okay? So that's the other way to go about it. Elimination is very, very important. It gives you statistically a better chance of getting it correct, and that's the main thing you want to do, is get it correct. So as you're looking at the choices, if there's something that is just, it can't be it, right? It's what we call an absurd choice, right? Like it says what, I don't know, what modality, and I just go back to modalities because those are in my head because I teach modalities, but what modality would be the best choice for this patient that has peripheral artery disease? And your brain is already like, no, cold, because they have peripheral artery disease. And then you see cold, you see 2 cold choices. Those are not it. So now you only have to choose between the other 2, right? You can rule those out, right? Those would definitely be a no. So you can just immediately strike those out. And the exam does have, the exam tools do have a strikeout feature that you can literally put a line through the ones you don't want to look at anymore, okay? If 2 choices have similar options or the words mean the same thing, just worded in different ways, those are not it, right? If it says your patient has, you're looking at the patient's skin and they're having an issue where you think they're prone to a wound, right? What would their skin look like? And then A says blue and B says cyan. A and B are the same thing. Blue and cyan are the same thing. So those two cannot be the answer. Because how do you pick between the two if they mean the same thing? There's no way that could be your correct choice. Your correct choice has to be standalone, a correct choice, right? It can't be the same meaning as another option, because then different students would choose, some would choose A and some would choose B, right? So it can't be any of those. So if they're very similar options, that's not it, okay? If you see absolutes, it may be very likely that that's not it, okay? It's not always right, because there are times that absolutes are absolutes, but a lot of the times those are wrong, because in healthcare and in just real life, there's not a lot of absolutes, right? So if it says you should never use a cold pack, like, we know that sometimes you could and sometimes you can't, and it depends and all that stuff, right? You should always strengthen the bicep. Like, maybe not. What if, they're flaccid and they have no connection? Like, it depends, right? So those absolutes, a lot of the times, you could eliminate, okay? And if it doesn't have factual information, then you want to eliminate that, right? Anytime you look at a choice and part of it is true, but the other part is not true, then that means it doesn't have enough factual information to be correct. So that part that's not correct makes the whole choice automatically incorrect, okay? If we look at the question down here that is given as an example, a PTA instructs a patient with a Foley catheter in ambulation activities. During ambulation, the therapist should position the bag in which position? The first thing I look at is, okay, these are the keywords I'm thinking of, right? We're talking about the position of the bag. That's the action. The therapist should position the bag. The therapist should position the bag. So I'm the therapist. Where am I going to put the bag? Okay? That's the first thing that goes in my head. Then I look at the keywords. Foley catheter. Okay? I have to know what that is, right? Foley catheter, that's for urine. That's going to be, attached usually to their pubic area, and it's housing urine. Okay, cool. During ambulation, so I'm like, okay, so we have to take it with us. So it's not going to be like, leave it on the bed. Because if we're walking and it's attached to them, that's not one of the choices, but that's where my head is going, right? So now I've gathered the question, I've gathered the keywords. I'm like, okay, position the bag. I'm the therapist. Where am I putting it? We're talking about the bag that has the urine because it's a urinary catheter. All right. And then I would formulate in my brain, I think it's this. I think it's that. Maybe I know, maybe I don't know, right? But maybe I have an idea, and then when I look at the choices, my choice is there. Oh, okay. Maybe it's not, and I have to look a little bit deeper into the choices. But if I'm already thinking it's urine, urinary catheter, the two options that say above the patient's heart or below the patient's heart. So you have two options that say bladder. You have two options that say heart. Well, urine is connected to the bladder. So to me, 1 and 2 are more likely to be correct than 3 and 4. I would eliminate 3 and 4, because what does the heart have to do with a urinary catheter that's attached to maybe the bladder, right? Bladder and urine have more of a connection than heart, right? So I would probably take out 3 and 4. That leaves me with two choices, 50% chance of getting it right now, right? Okay, above the patient's bladder or below the patient's bladder, now I have to think of the actual principles of therapy, right? Maybe I already formulated that choice. Maybe I have to think back of what I know. I should know that an output type of thing where stuff is coming out of the patient. It needs to drain into the bag, which means it needs to have gravity assist with the draining, which means it needs to be below wherever the point of insertion is. And the point of insertion is the bladder, so it's going to be 2, right? So now I cut it down, I rationalized, and I figured out the answer, right? So that's how I would kind of target a question every time, okay? Again, if you are formulating a choice and it's there and nothing else in the other choices calls out to you, do not change your answer. Statistically, it has been studied and shown that changing your answer messes you up, that the one you thought about first, a lot of the times you're correct, especially if you're really not sure. There's a reason why that one's calling you. There's something in your brain telling you that. It may not be super clear in your recall, but something is pulling you there. So just go with it, okay? So the exam, again, is 4 sections of 45 questions, totaling 180 questions. And so it lasts about 4 hours, about an hour per section. And in between, in the middle of section 2 and 3, they have what they call an official untimed break. Untimed meaning if you feel you need every second to complete the test, the 15 minutes in the middle, it won't go against your time on the test, right? They're giving you free extra time, if you will. It is 15 minutes long, but you don't have to take the full 15 minutes. If you only want to take 5 minutes or whatever, that's fine. However, just keep in mind that if you pass the 15 minutes, the exam is just going to start, okay? It's not going to wait on you to be there or click anything. Then they're going to start taking away your time. So you have to be responsible. If you walk out of that room and take a break to come back, within a reasonable amount of time. If not, you're cutting into your time, right? Now you have to think of how have you taken exams in your schooling, right? If you have always finished pretty quick and with a lot of time left, then you probably don't need the full 4 hours. You may finish the boards in 3 hours, 3.5 hours. If you've always been the one that you're like trying to answer every question and you have a minute left and you're worrying about your time, then you may need every second of the boards as well. So don't take too long of a break, okay? Sometimes we take breaks because of basic needs, right? We need to go to the bathroom. We need to grab something to eat or something to drink because we're feeling dehydrated or hungry. So try to take care of all that as much as you can before going into the exam. But if you need that, you need that, right? When nature calls. But don't think that you should only take breaks to go to the bathroom, okay? Sometimes we also get a little bit of brain fog and a little bit of like dozing off and just, like our brain disconnects for a second. And you're sitting there in the test disconnecting and being distracted and you're not paying attention. So if you are that type of person, you may need to take little breaks during the exam. And yes, it is cutting into your time. So you don't have to make them long, but try to do that, okay? Because sometimes, especially towards the end of the exam, you just start wanting to go through it because you're like, I want to get this over with. And it'll help to take other little breaks to not feel like that at the end. Because sometimes when we get there where we're just like, I want to get this over with, then we start not answering things correctly, and that could cause, a failure that you don't want, right? So take advantage of your break when you have it untimed. And if you need to take little other ones that are going against your time, take a minute. That 1 minute, 2 or 3 times during your whole test shouldn't hurt you too bad, okay? Just don't make it super long, okay? And again, if you take care of your needs as much as possible, you get a good night's rest the night before so you're not super sleepy or super distracted or super tired. If you don't drink or eat a whole bunch of stuff before you get into the exam and then you have to pee and use the restroom, That will help you not have to take as many breaks because it is a long time. But if you need the breaks, take the breaks. Okay, don't forget about that. Okay. In order to try to mitigate exam fatigue, the best way to do that is to take your mocks, and take them the whole thing, because there are mocks out there that are 180 questions, and take them like if you were taking the real thing, and see how you can manage that before the actual day of the exam. Do you need breaks? Do you not need breaks? Do you need to work your way up to the 4 hours? How does that work for you? You shouldn't be experiencing this only the day of the exam. You should be experiencing that other times in your life, okay? If you're like us in our PTA program, you've taken long exams. Maybe they're not 4 hours, but maybe they're 2 hours, right? Your finals. And if you're in our program, you've also taken mocks, because we give you lots of mocks. So with us, you've experienced this before. But if you are from another program or another school or something, then you might not have had those experiences. So just make sure you do that for your own. There's lots of mocks that you can buy out there that are lengthy, and you can kind of practice this part and try to make it as realistic as possible to the real thing, right? So don't do it in your house with your family around and the kids coming in, and do it in a quiet space where nobody will bother you for 4 hours. Put on, little earplugs if you feel you need little earplugs. They do allow the foam plugs in most prometric centers. So if that's something that helps you stay focused and be less distracted, use those. Sit in a chair like you would at a center, not laying down on your bed, stuff like that, so that you can make it the most realistic to what you'll be experiencing that day. Okay, so the NPTAE or NPTAE uses a criterion-based scoring system where the minimum passing score is a 600, okay? The problem is that there is no way to tell you exactly what a 600 is. Is it, 80 correct? Is it 90 correct? I cannot tell you specifically. It all depends on your exam and the types of questions you get. But what that means is they assign, if you will, points to each question. If it's a harder question, it's worth more points if you get it right. If it's an easy, what we call level 1, like level 1, level 2, level 3, if it's an easier question, level 1 style question, it may be worth less points, okay? If you have an exam that has lots of easy questions, you'll need to get more right to add up to 600. If you have a harder exam that has lots of harder questions, then you'll need to get less right because they're worth more. So you don't need to get as many of them right. So that's why there's no way to tell you exactly how much you need to get right, okay? But again, it's out of 140 because only 140 are scored. And usually, if you're taking like a mock or something, you need to get about 65 to 75% correct. Again, the easier exam, maybe you need to go more towards the 75. The harder exam, maybe you need to go more towards the 65. So an example of this could be like person A takes an exam, they get 63% of the questions correct out of 140. That could be a passing score. And then person B takes another version of the exam and they get 68% correct of the 140 questions, and that's a passing score for them because they had an easier exam, right? So that does happen, and that can happen, and that will happen because that's how it is. They have the different versions of the test, and some are harder, some are easier, and so for each person it could be a different number that you need correct. But it is a lot of times, again, around 65% or higher, okay? 65% or higher. So 65% of 140 is 91 questions correct. Okay, so I always say 100 because, again, if you shoot your shot and you set your goal even higher, even better. And it gives you a good, like, even concrete number to think about. But out of 140 things, you can get about 40 wrong, and you should get about 100 right, right? If you kind of stick with that as a baseline goal, then you'll have a good goal to help you pass. But on the real thing, I mean, it could be less, it could be more, it could be many things depending on your version of the test. Okay. So for my students, I always tell them to shoot for 65% as a minimum, but really 70% is even better. So as you're preparing for your boards, once you decide what date you're taking this, you'll know how much time you have, okay? Do you have 2 months? Do you have 4 months? Do you have 6 months? You could be basing this off when the next test is, like, oh, right now it's January, but the next test is in April, so I just have 3 months in between. Or it could be something personal. You could be like, it's January, the next test is April, but I may need more time, so I'm going to wait till July. So now I know I have a good 6 months, okay? And hopefully your program or your team can help you with that. Me, with my students, I do advise you based on how you've done in the program, how your mocks are, if I feel you're ready to do it in 2 to 4 months, or if you need 6 months. I have had students that they just needed the 6 months. It's not that, it's not that they couldn't have taken it in April if they wanted to. The date was available, but I just say, based on what I see you scoring, you need more time. And they passed the first time, but they needed more time, right? And they did mocks and they did all kinds of things for us to work together to see when you're really, really, really ready. And you're not really, really, really ready until you are, again, consistently getting 65 to 70% on every mock you take, and on every mini exam you take, and on everything you take. You're getting a lot of it right, right? If you have exams or things you're taking to practice where sometimes it's good, sometimes it's bad, sometimes it's high, sometimes it's low, it's inconsistent, I wouldn't say that you're ready, if I'm honest, okay? You have to see consistent progress, and you have to have something to gauge where you're at, okay? And a lot of times for exams like this that are multiple choice, it's just best to take a whole bunch of those and see where you're at, okay? I am going to give, my students a good sample schedule. Maybe your program or your school, or you can find online a sample schedule. But in the end, whether I make a schedule for you or not, you have to think about what it is best for you. Mine is just a sample, right? I put everything in there. I spread it out in a certain way. Maybe you need one that focuses more on certain things than others. Maybe you need one that's longer because, again, you're taking the 6 months instead of the 4 months. So you will have to figure out what that looks for you, okay? But like it says here, you also have to make it good for you, because you have to assess your available study time, right? What does your day look like, right? Are you making it realistic to you, okay? If you know that from 9 to 11 in the morning, you don't function, like you're taking your time, you're getting up, you're eating, your brain is just not awake, right? Then don't put your study schedule, oh, I'm going to study from 9 a.m. to 5 p.m. Half of that day, you're not even there. Change your study schedule, make it different, right? If you know that you want to, work out or do something for you that helps you wake up more, or just helps you feel good, because you need to be in the best state to study. then, put in your workout time in your schedule. A lot of people, I say, make a schedule, and then they are just like, I'm studying from 9 to 10 o'clock at night every day. Nobody's doing that. When do you eat? When do you take a shower? When do you use the bathroom? You never take your dog out for a walk. You don't have anything else going on in your life. Like, nobody's studying from 9 a.m. to 10 p.m. Okay? So that's not realistic. So you try to make it as realistic as you can, because then it'll be sustainable and you'll be able to follow through with it. If you don't, then you're just kind of winging it. And when we start winging stuff, a lot of times we don't stay consistent with it and we don't stick with it. So you want to make it what it is. Okay. Then the other thing that it says here, break down topics. Divide the exam content into smaller, manageable sections for focused study sessions. Allocate time to review and practice is the last slot. So break down topics is what I was saying. Maybe I, as a student, I need more focus on cardiovascular. And you got a sample schedule and it says we should study cardiovascular 2 weeks. But maybe I'm like, no, I need 4 weeks on cardiovascular because I suck at cardiovascular. Then make your schedule that way. That's what you need. Okay. And allocate time for review and practice. When I make a schedule for my students, I put in there, make sure you review the topics you studied, or this day you're going to take a mock board. Okay. Because if you're not reviewing, then you don't really know how well you're studying. Okay, and that's the part that students miss the most. They forget the review part. They study, but they forget the review time. Okay, so make sure that you include, like, let's say you have a week, Monday through Sunday, right? Monday, Tuesday, Wednesday, you study a topic. Maybe Thursday, you do a little quiz or you do a little activity about the stuff you just studied the previous days, right? And then you see if you got it. And then the next day, if you didn't really get it, then go back to what you studied Monday, Tuesday, and Wednesday and see why you didn't get it, right? Like, oh, I realized that I thought I was really learning it, but I guess I didn't learn it good. Let me go back to that, okay? Or let me reorganize my schedule to add this back in because I didn't master it yet. Until you master a topic, you shouldn't be moving on from it. You should be adding it back into your study schedule, okay? And for the best way to stay organized, because a lot of times these exams are 2, 3, 4, 5, 6 months out, is to consistently set up a schedule, a monthly schedule, and then a weekly schedule. And if you really want to be organized, a daily schedule. Okay, so you can literally check off, today I did this, today I did that, okay? And again, including all those things that you really like do in your day. Do you need 30 minutes to eat? Do you need just a mental break? Add it in there so that it can be realistic. And again, over the course of the 6 months, maybe there's 2 weeks you're on vacation. Account for that, like, don't stop your life to think you have to study every day forever, but account it, put it in there, okay? So for this part, which I kind of discussed previously, the way I advise my students to do it is to use their board prep book, okay? Because the board prep book is already broken down into what's most important, what's least important, how, you'll notice like we use score builders a lot, right? That's a very common one. If you look at the score builders book, the first chapter is MS. Why? Because MS is the biggest section, because MS is the most important section. And if you look at the size of the MS chapter versus the equipment and technology chapter, the MS chapter is much thicker, is much lengthier. It's made like that for a reason, because Score Builders, who has been around a long time, even when I graduated in 2009, right? I had like a version of the Score Builders book, right? Maybe version 2 or 3 or something. They know a lot about NPTAE. They've been working on it for many years. They're a well-known company, and they know the breakdown, and they adjust to the breakdown every time it changes. And they know that the MS chapter is first because it's super important, and it's thicker because it needs to be thicker to accommodate for the fact that it's the one that has the most questions on the boards. Okay, so I always advise my students, look at your board prep book and just make little topics on that, right? If we open it right now, it'll say, MS, and then it'll start with maybe like anatomy and physiology stuff, right? Muscle fibers, muscle receptors, joint receptors, actions of muscles, joint names, and ligaments of those joints, like a lot of anatomical stuff. So that's how I would break down my studying. Week 1, MS. Day 1, anatomy of the joints. Day 2, muscle receptors. Day 3, joint receptors and skin receptors. Day 4, arthrokinematics. Day 5, like that, okay? And using your board prep book can be a good, already kind of broken down resource to know, because a lot of times we're studying for these exams and we're like, where do I start, right? Like if you think about your program, you're like, we learned so many things, where do I even start? The board prep book already kind of has it organized for you. Just use what they're giving you, but make it your own, right? Or what you could do is you could think about your program and break it down how your program breaks it down. Oh, okay, the first class we ever had was intro. Okay, week 1, I'm going to study intro topics. Okay, I'm going to study the APTA. I'm going to study the role of the PT and PTA. I'm going to study cultural competency. A day, maybe not all day 1, but maybe week 1. And then week 2, okay, what did we have after that? Oh, we had patient care techniques, patient care skills. Okay, so this week, these 2 weeks, I'm going to study all the patient care skills stuff that we taught. And then week 4 and 5, I'm going to study all the functional and applied anatomy stuff that we taught. So you could break it down that way too. So use what you already have learned from to do your breakdown, okay? I would start with the board prep book, because you probably have one, and it's a good guide again. And then when you're studying, you can go back to other books, like the actual patient care book or the therapeutic exercise book, to really get deep into that topic. But I would start with my board prep book as the starting point and the first resource to kind of see the bullet points, to kind of see the objectives of what's most important, to organize myself, and then if I need to go into those other books to look deeper, then I will, and I do. Okay, I already talked to you about this. Again, don't forget the assessment part. Every week you should be assessing what you learned, and if you didn't completely learn it, if you feel like you self-assessed and you can't remember anything you studied this past week, then you need to add it back into the calendar, okay? Because the point of you is not to sit for 3 months and read stuff that you don't remember. The point is for you to actually learn it so you could apply it on your board. So if you need to re-add it in, you need to re-add it in. And if that's happening every week, where you're self-assessing and you don't, and you're realizing you're not learning the stuff, then you need to either work with people in your program, your peers, somebody, or just check yourself or look up information online or something on how to study properly, because there's something missing there then of why you're not getting it week by week. And you need to figure out what that is, because you don't want to spend the next 3 months studying incorrectly and constantly having to go back, right? So you have to find what set of techniques or something you need to figure out how to study properly. Okay, so I already kind of talked to you about starting with the board prep book. Again, Score Builder and Therapy Ed are the most popular ones. They've been around for a long time. They've been proven to be very successful. Most students use them. Most students have them. Of course, nowadays there's so many other things and things that have emerged. But I would start with one of those, okay? If you want me to compare between those two score builders, I like a little more because it's a little more visual for me, that I'm a visual learner. It has lots of good charts. It has lots of pictures. But Therapy Ed puts things in bullet points and can really kind of get you to like certain key elements, whereas Score Builders has it more spread out. And Therapy Ed is great with charts. Therapy Ed has great charts. They don't have as many pictures, but they have great charts. So my visual organizational mind likes that part of it. Okay. Both of them include 3 practice exams, 3 practice mocks. So if you get both of the books, that gives you 6 practice mocks right there off the bat. Okay, because the books come with the practice mocks. And the thing about the practice mocks that those books have is that you can go online and set up the little system or whatever and take it online, which is similar to your boards, right? Because your boards is not done on paper. So it'll help. And a lot of times the way they do it on the online system is very much like the real thing. Like they'll give you the little tools to scratch things out and to flag questions, just like the boards had. So that's great. If not, there may be other books out there that you find that are new, maybe not as well known, but you can definitely use them as a supplement. Of course, the books you had in school, Therapeutic Exercise, your Physical Rehab, O'Sullivan book, those are really, really good ones to have around to go back to. But again, I would start with my board prep book as a guide, and then use those program books to fill in the gaps and to like add more detail. Okay. As much as people think the board prep books has everything you need to know, it doesn't. Okay. It has the basic concept. Hey, so let's say like fast twitch receptors and slow twitch receptors, right? It'll give you a chart. Fast twitch receptors in the muscles, they do this, right? They're for power, they fatigue easily, blah blah. Slow twitch receptors, they're for endurance, they don't fatigue as much, they're found in this area, they're found in this area. They'll give you that. Now, if you study it deeper, maybe using your therapeutic exercise book, you'll see that you can apply that to different exercises. You'll see what parts of the body has more fast twitch, what parts have more slow twitch, and why. So that's how you get deeper into it. And the board exam can have questions where you have to know the depthness and go and have a better understanding. It's not just like, what are fast twitch receptors? It's how you apply the fast twitch receptors, right? And you may not get that from the board prep book. It'll be in the board prep book what it is and what it does, but the application part may be coming more from your Therex book. So that's what I mean by going deeper with those, okay? Other study materials you can use are, again, all these board prep programs have things that they sell. Yes, none of it is free, unfortunately, but Basecamp is a thing from Score Builders where it gives you a lot of questions per topic, and then you have like these little arenas where you can quiz yourself and test yourself. They also have PTA 365, which is free, and you get a daily free question. Therapy Ed has an app as well where you get daily questions, and you can also do like little mini exam things. Pocket Prep is another one with lots of questions. A Final Frontier is one that people use sometimes. They have like live courses, they have self-study courses where they kind of go through everything. You can watch videos on topics, and then they also give you like little quizzes and stuff. PT final exam also. They have lots of mocks that they sell, and also like a prep course. Board Prepper has a prep course. Some of these courses are set up so that you like literally log in on certain specific days, like a live type of thing, and you have to do it within a time frame that they give you. Some of them are set up where it's self-study, right? Like they give you all the videos and they give you all the stuff, but you go in there and you follow through when you want. True Learn has a lot of mocks, and you can make your own quizzes and stuff on specific topics or just like a big one. PTA Elevation is a very popular one, albeit on the higher end price wise, but my students have found a lot of success with it because the creator is a PTA turned DPT, but she was a PTA herself. So she understands the breakdown of how to make it PTA level, of what we really need to know versus what we don't need to know. And she's very straightforward, like, hey, this is super important. Hey, no, this is how you break this down, or you don't really need to worry about that. And again, there's videos, there's quizzes, there's study guides and stuff like that. And a lot of these courses go through exactly what I'm going through right now. How to break down a study, how to make a study calendar, how to study, how to self-assess. So that's helpful as well. All right, so going back to effective studying. Again, a lot of people think they know how to study, but they don't know how to study, right? And that's where the problem comes in. It's not that anybody, I think, is smarter, dumber, or better, or weaker, or anything like that. I think it's anybody can do this, as long as, number one, they're super committed, and number two, they know how to study, whether they're doing it on their own or getting help from maybe a faculty member or a peer. Okay, and I say that because of my experience, right? I consider myself a quick, strong student. I could probably learn, like, go to a class and take a test on it and pass it easily. But not everybody is like that. And in my program, I have had students that are like that, and I've had students that struggle throughout, okay? But even those students that struggle, they pass their boards. It may take them longer. They may even fail once, okay? Or they may just do what they have to do and figure out and get extra help, and come in every day and see me every day and whatever it is to make it through. But they make it through is my point. That's why I say I think everybody's capable. Because when you look at a student and you just see, how they learn in that moment, and then they're asking you these questions that you're like, why are you asking me this? Or, my God, I have to explain this again. You can be, biased and judgeful, but their processing may be different and they may need more time. And it's good at least that they recognize, and if you're willing to work with them, or they're willing to put in the extra time they need, they can do it, and they will do it. And I've seen them do it. I've seen the C students pass the boards. The difference to me between a student that wasn't like the typical, I know they're going to pass type of student. I've had students fail and I've had students pass, okay, in that range. The so-so students, right? The always need a little extra help student. The ones that I have seen pass, the difference between the ones that have passed and the ones that either never passed their boards or are still working on it or gave up or whatever, is heart and effort. That's the only difference I've seen. The ones that are talking to me every day, the ones that are meeting with me, the ones that are like, yeah, no, I've been really putting in effort. I set aside my job. I set aside everything. I study every day. I ask questions. I write things down. Those are the students that pass, okay? The students that they think, oh, if I just read it and I keep reading it, I'm going to get it. Those are the students that, first of all, you probably never knew how to study, and second of all, you're not putting in the time and effort that you need, which may mean extra time and effort, to do some active studying that is actually good and efficient, okay? So studies show that passive studying does not work. And if it does, it works for some people, but not a lot of people. So what is passive studying? Passive studying is reading. I look at this, or watching. You guys are watching this video, and then that's it. You don't do nothing else. You just watch it and you go, okay. That's passive studying. Reading a book and going, okay. Passive studying. Listening to a lecture, the teacher's in front of you, you're looking at them like this, and you're just sitting there listening. That's passive studying. That works for some people, but most people, it does not. Okay? What most people need, that studies show work the best, is active study techniques. Okay? Active study techniques. That means summarization. That means self-testing. That means teaching others, like it says in these little bullet points. Okay? Okay, so summarization means, like it says here, notes, taking notes. Because what happens when you take a note? You cannot word for word copy what is coming out of my mouth, which means if you're taking notes, you're actively listening, processing it, and then putting it into your own words, and then writing it down as fast as you can, how you kind of can understand it, okay? Which makes you process it. Because reading and watching is listening and intaking, but it's not always processing into a way that your brain can understand. So when you take notes, it forces you to process, okay? If you're sitting there taking notes trying to copy exactly what everybody's saying word for word, that's not processing. That's the same as passive learning, except now you're writing, okay? You need to make it into your own words. And if you cannot write everything you want to write in that moment that the person is talking, then you need to write little keywords to go back to and fill in later, okay? Making flashcards, okay? Definition. On the front, it says the word. On the back, it says the definition. You look at the word, you go, it's this, 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 and this. You flip it. Oh, I got it right. Now you know you're learning it, right? If you're getting it wrong, then you can put that flashcard to the side and then come back and test yourself again when you studied it a little bit deeper, right? Flashcards should not be notes on a flashcard. It should not be a whole bunch of words on a flashcard. Flashcards are meant to be active learning strategies that you flip over so that you test yourself. Not that you have a smaller little section of notes. That's, again, very passive, okay? Concept maps, okay? You can look that up. You can go to Google and look up what a concept map is. Again, you have like a keyword in the middle and then little pieces sticking out of how those connections connect to the keyword. Let's say in the middle you have Parkinson's. Then you have like a little branch sticking out where it may say tremors. Then from tremors, you can branch out to resting tremors, like pill rolling, right? Then you can have another branch that says hypertone, and then from there it can say rigidity, cogwheel, and lead pipe, and then you go deeper into the branches and you kind of connect it all to Parkinson's, right? That's a concept map. Again, if you're making one, I don't mean copying one offline, I mean making one yourself. Then you're processing the information. Okay, if we take pictures of other people's concept maps, of other people's flashcards, and we don't make our own, we are not processing. So you have to make your own. Again, apps, right? I told you about the PTA 365. I told you about the NPTAE Pocket Prep. I told you about the Final Frontier has an app that also gives you free daily questions. Okay, that can be a way for you to ask yourself questions. And a lot of those, at least I think the Final Frontier one and the Pocket Prep, you can put like, just ask me questions on neuro, just ask me 5 questions on cardio, just ask me 5 questions on equipment. And if that's something you just studied, it'll help you do like a little recap in the brain of how much did you learn about it? Do you really understand it? Can you answer these concepts and questions, right? And then practice exams, of course, are mocks, okay? You need to constantly assess yourself and see if you actually are learning the stuff, okay? And that's done through active learning. And again, active learning is how you play with the information. Do you create things? Do you highlight things? Did you make a flashcard? Other active learning strategies could be, I'm trying to think of other ones. Could be explaining to somebody else, right? Having a family member quiz you. If you're studying something that's more visual, like wounds, pull up a picture of a wound. Can you describe that wound? Can you tell what stage it is in? Can you think about what dressings you might use for that wound? Can you think about what patient may have that wound? Oh, I think a patient with venous insufficiency would have this type of wound because this looks like a venous wound. Okay, well, branch off now. What does venous insufficiency look like? What else do you know about venous insufficiency? What does that patient look like? What are conditions lead to venous insufficiency? Like, you can get bigger and bigger from there and really build on top of what you're learning at the moment and put things together too. Okay. This goes back to what we were just talking about, but again, this is key. Okay. When I studied for my boards, I got my Score Builders book and I went through the chapter and I made a question on every topic I was reading. Okay. So, like, for example, let me see if I have a board prep book here. Okay. So here's the Score Builders book, right? I'm just going to open to a page. I opened to a page that says breathing exercises. It gives you different breathing exercises. It has diaphragmatic breathing. It has segmental breathing. It has sustained maximal inspiration, pursed lip. And then it says diaphragmatic breathing, used to increase ventilation, improve gas exchange, decrease work of breathing, facilitate relaxation, and maintain or improve mobility of the chest wall. So what I would do is, instead of just reading that, I would create a question. What are some of the purposes for using diaphragmatic breathing? And then the answer would be to increase ventilation, improve gas exchange, decrease work of breathing, right? And then when I would study, instead of just reading this, I would read my question. What are some of the purposes of diaphragmatic breathing? And then I would be like, increase ventilation, I think was one. I know it said something about decreasing work, and I would answer my own question, and that's how I would study. And then it says, explain the procedure to the patient, and it tells you the procedure. Have the patient semi-recline, place the hand on the angle of the thorax, apply pressure. So then I would write a question about that. What is the best position for diaphragmatic breathing? Semi-reclined. Where should the patient put their hands for diaphragmatic breathing? Answer is over the subcostal angle of the thorax and the stomach. Like, I would literally write questions from what I was reading, and when I was studying, I would recite those questions and answers. But I would ask the question without the answer, obviously, trying to remember the answer. And then I would check my own answer sheet and see if I got it right. And that's how I would study. And I would take that with me everywhere. To the gym, to my job, to the car, right? And every week as I'm studying a section, I would create these little questions. And then I would read it. Then I would create the questions. Then I would study the questions and answers. Okay? And then the more that I answered questions right, I would start like crossing them off or checking them off, because why am I going to keep studying the same question that I got right 1,000 times? That means I know that question. But maybe there's 2 other questions that I had to keep reviewing. And then as we got closer to the exam, hopefully I knew the answer to all the questions, right? So that's what I would do. So making your own questions, right? If you're not good at making questions, that's where you can use your peers and your friends to try to, maybe your peers made a really good question thing. You can use that, okay? Again, the flashcards, the mocks in the back, okay? If you look at the mocks in the back, every time that they give you the little answer key to the mocks, it tells you the category of that question. So, for example, this question is a non-system safety and protection question. So when I'm studying the non-system stuff, maybe put a resource of those questions, put it aside, and as you're studying that topic, pull only from the non-system questions of these quizzes rather than the whole thing, right? AI, nowadays you guys got that. You can literally ask your AI sources, ChatGPT, Gemini, Copilot. You can ask them, can you make, but you have to be real specific. Can you make me a 10-question quiz for the NPTAE PTA exam on infection control practices for in the hospital? Okay. If you're very specific, they will make you little quizzes, and they'll give you an answer sheet, and then you can be like, can you put the answer sheet separately so that you can try to answer the questions and then have the answer sheet separately so you don't just like look at the answers, you know, and have them make it for you. Quizlets are out there that people already made. Again, if you don't want to make your own, use other people's, but just make sure the information is correct, okay? And teach others. Teaching others will always, if you can teach it, you know it. If you're like, I don't know, let me go back, then you don't probably know it that well. You need to study that a little bit more, okay? So group sessions are important for that, because a lot of us need that social interaction and that discussion. And I know sometimes after school, like once school is done, everybody goes their separate way and you guys don't want to interact anymore, but you should, because it's very helpful, okay? And this is what I just said, right? Teaching others. So, you know, no need to say it again, but here's that concept right here again. As I said, when you make your study schedule, especially with the monthly one, okay, interject in there how many review sessions you're having and how many practice tests, whether they're mini tests on that specific subject or like a whole big mock, how often you're gonna have those, okay? You should have mini quizzes or at least a mini review session after every week after you study whatever you study. And then you should have the big mocks. If you have, again, about 4 months until your exam, you should be taking 2 to 4 mocks if you can, okay? I know the 4 is a little bit harder because that would be 1 per month, and you know, it depends how you break it down. And if you're only having 2 to 3 months, maybe you don't have time to do 4, but at least 2 mocks before you go to the real thing. And on those mocks, you should be getting your 70%, okay? If you are getting a 50% every mock, you're not ready to take the exam. And if you're taking a mock before the exam and the exam is a week from now and you're getting 50%, and that's how you, again, statistically been performing, you're going to go in there and you're probably going to fail, okay? We can't ignore statistics. Yes, there's exceptions, but you want to go in confident and ready. And if you're not ready, that's okay. You can get ready, but don't rush it because you're wasting time and energy and money, okay? Again, it depends who's looking at this, but the exam for PTA costs $485, okay? You also have to pay a retake fee to the Florida Physical Therapy Board, which is $100. And then you also have to pay the per metric fee, which is like $90. So that's like what? $500, almost $700, right? $700, $800. Close to it. Every time you retake the exam, you don't want to go in there not ready, okay? If you paid for it and you're not ready and you want to back out of it, you can do what is called a withdrawal. You can withdraw your registration, and you can say, I'm not ready. They will charge you a fee. Okay, the closer it is to the exam, it's like $120 or something. But better to pay the $120 than pay the $700. Okay, so make sure that you're ready. 50% is not ready. Okay, so when you're taking those, look at what the score says. No, none of these mocks in your therapy ed or in your score builders again says like, yes, taken out. They just give you the score. They do give you the example or the comparison of how you're doing compared to everybody else. So they'll be like, everybody who took this exam, the average is, 68. You got a 56, right? If you're really far from everybody, then you're not ready, okay? The PEAT, which is the Performance Practice Exam Assessment Tool from the FSBPT, which uses retired actual exams that were given to people at some point. They're the best source of the one that you should take right before, because number one, they're made from the same people that make the boards. Number two, they use retired exams, so a lot of the questions are very similar or could be almost the same of the board you're going to take. Not all of them, but there may be some that pop up out there. And number three, they have a 95% accuracy of predictability on when they give you a little report, and it tells you like, this is what we think you would score if you were to take the real thing. And it's 95% accurate. And number four, the report they give you looks exactly, and the system and the layout and the tools and all that stuff looks exactly like the real thing. So when you get the report, it gives you the percentage, and it gives you the score, a 600, a 620, a 650. And you can have an idea of, if this was my mock today, would I pass it? And if you're not passing it, you need to think about why and how far you are. Because if you need to get a 600 and you're getting a 500 on the P, you're not ready, okay? And the P will give you that 100 score, so it's good to look at. And then it will give you what they think you would get in the real thing. And then they give you like a range of, how many questions you need to improve your score and all kinds of stuff. So the PEAT is a great one. So again, this is just going through the breakdown of what I just said. Your assessment, you should do an ongoing assessment of the mini stuff you learned every week. And then you should do the big assessments of the mock exams, every so often as well, about once a month in a 3 to 4 month period, which is normal to study for the boards, about 2 to 4 mocks. If you're studying longer, maybe more. If you're studying shorter, maybe less. And then all of the exams give you, again, some sort of report where they give you like the total you got right and the total you got wrong and how that compares. But they also a lot of times break it down by body system, just like you saw in the content outline, like it says cardiovascular, integumentary, like all of that. Almost every one that I've seen has a breakdown. Some go a little more detailed, some go a little less, but they all have a similar breakdown. So you can see like, I'm good in cardio, but not so good in neuro or whatever it is, and really tailor the back half of your study schedule to that, okay? And when it comes to your study schedule, the reason why, again, we're self-assessing weekly and we're self-assessing big is because you should be constantly updating your study schedule. You should be constantly changing it, okay? If you were going to spend 3 weeks in MS, but every time you're self-assessing or in your mocks, you're not doing so great in MS, maybe you need to add that back in. 1 day per week, you need to add MS back in, okay? So that's what this needs to tell you, and that's how you need to adjust to that on your study schedule. Your study schedule, weekly, monthly, or whatever, should not be rigid. You should have a way that you can change it so you can adapt, okay? And when you're looking at the questions and studying like the rationales and stuff, Don't just look at the right answers. Look at what makes something wrong. Did you know that? Did you catch that key word? Did you understand by looking at it why this couldn't be it? Don't just study the right answer. So again, to summarize, you should be doing little tests and big tests, but the big mocks can be found in your board prep books. But again, score builders sells mocks that you could take. The PEAT, you could have options there that they sell. They sell a student version that gives you 2 exams. Therapy Ed again has their 3 mocks. They also they don't sell like practice exams by themselves, I don't think, but they have that app that gives you questions. PT Final Exam, you can buy 6 practice exams. True Learn just has a big bank of questions, and you can make big ones and little ones on specific topics. I like the ones that you can make specific topics, right? So like, hey, can you give me a little exam of 20 questions on just interventions for musculoskeletal system? Because if that's what you just studied, you want something that just has that to really see if you really know what you just studied versus just everything. So that's what I like about the ones that you can do that with, and a lot of them you could. Even with score builders, if you look at the back of the book, and the exams, the big exams they give you, if you go into the little system, you can make custom exams and you could break it down. Okay, so this last section is again about techniques and why it's important to not do passive studying and do active studying, and how to do that consistently without just kind of reading and not doing things effectively. And so we're gonna talk about again the research, which spaced repetition is a big deal in studying, and lots of research shows that that's important for people to actually store stuff into long-term memory. We're going to talk again maybe about flashcards, maybe quickly because we already talked about it, but that comes up again. Mnemonic devices and visualization. So spaced repetition is a concept that basically says that, again, we don't look at stuff just once. If you look at learning research, if you even look at rehab learning research, which again, if you are talking to me or watching this because you're a PT or PTA, you're literally teaching people. And if you're literally teaching people, you need to know about this too. It's the concept of neuroplasticity. It's the concept of learning strategies, which basically is we do not learn things by looking at it one time. We have to look at it several times. Okay? So spaced repetition is a concept that basically you space out what you're learning, right? If I look at bones and muscles this week, I should be looking at them again next week, and then a week after that, and then a week after that. I shouldn't just study it that one time and that's it. I learned it, right? And so that's why I say with your study schedules, you may be breaking it down into different topics, but if you need to add stuff back in to repeat it, or on your review day, if you want to review a little bit of everything, you should, because then that means you're doing spaced repetition. And if you can connect concepts, right? Like maybe you are studying neuro right now. You're studying neuro topics. You're doing a neuro day. But as you're studying neuro and you're talking about MS and you're looking at some of the issues that they have, you're like, okay, they usually have weak lower extremities. What are the muscles of the lower extremity? That's going back to MS, maybe something you already studied, but you're reconnecting it, you're revisiting it. That's what spaced repetition is, and that's how you should be studying. You should always go back to everything you can fill in to make the connection. Okay? Yes, you're studying MS, but can you go back to the muscles and recite the origins and insertions as you're reading? If it says they have flexor synergy of the upper extremity, Well, what muscles would be causing the flexor synergy? The biceps is a common one that gets really spastic with flexor synergy. Your wrist flexors too. What are your wrist flexors? Like, so you can go back to some of the old concepts within the new concepts. And that's what you should be doing. And that's how deep you should be getting with every study session. Okay, I already talked about flashcards and how to use them. Again, you shouldn't be just writing everything on a flashcard and reading off the flashcard. You should be use it as a recall to ask yourself questions. But whether you do it in a flashcard form or a quiz form or however you do it, just make sure that, again, you have a way to organize the ones you're getting right and the ones you're getting wrong so that you can go back to them, okay? And again, I know a lot of people talk about flashcards and we love our flashcards, but the reason why we love them is because they are good for active recall and just the, looking at the prompt and the questioning, but it's also because you could take them. You could take them anywhere, okay? You are sitting in the bathroom, you could have your flashcards. You are walking in the grocery aisle doing grocery shopping, you could pop out some of your flashcards and be like, what is this? And then as you're looking at the tomatoes, you could be thinking about it. And then you could see if you got it right. And then put it in this pocket because you got it wrong, or put it in this pocket because you got it right. Whatever, right? Like, you can be sitting in traffic and you know that the light doesn't change for another 30 seconds. You could look at one flashcard. So a lot of people get stuck to one, like, I don't have time because this and that. You do, but you have to make time. And sometimes that means that taking things with you. You can't take your books with you, but you can take your questions. You can recite stuff on a video yourself, on a recording app, on a flashcard, and you can take those things with you and study in these little moments that you think you don't have time. Okay. Mnemonics, again, the best way to study is to make things that make sense in your head. And sometimes it helps to connect to things we know, or just to make it silly or interesting. If you've ever studied the research on people who like memorize things for a living, like people have those competitions and stuff, or those quick readers or those quick learners, what they do is they connect it to something that they can remember because it's so outrageous and so silly, right? Like they'll picture like this weird thing where there's an alien grabbing, but then the alien reminds them of this concept, and then it's like it stays stuck in your head because it's just so outrageous. That's how mnemonics work, right? Like if you look at the mnemonics for the carpals that I learned, right? Scared lovers try positions that they can't handle. It's just so like silly and like sing-songy, and then it kind of triggers other parts of your brain to remember, and then it's just like what? And then you just kind of remember it. The part that students sometimes don't do is that they'll remember the saying, but then they won't remember the actual information. They'll be like, scared lovers try, and then they don't remember that S stands for scaphoid, L stands for lunate. So you have to make sure you recite it and practice it fully. But this is again coming from research that shows that your brain likes shortcuts, and your brain remembers things that you kind of have like an emotional attachment to, like something outrageous or something silly or something fun. You'll be more likely to remember it. So that's usually why mnemonics are made. So use those when you can. Just remember what the actual content is. Don't just remember the rhyme or the mnemonic, right? This again, visualization, is just research based that shows that when you do visual learning, most people are very good with that. Even if you don't consider yourself a visual learner, looking at the pictures, looking at the charts, making it something that connects with visual stimulus helps commit it to long-term memory. So like it says here, diagrams, charts. If you're looking at a condition, pathology, maybe look at the structure that's involved. things like that. Maybe look at the symptoms, like if you could have a visual of the symptoms. If the Parkinson's patients look like this, like you want to be able to look at that so that it can commit a picture in your brain. And sometimes you have to look for this information. When you're using your board prep books, they don't always have a picture. Like I said, Score Builders has a lot of them, but Therapy Ed doesn't. So maybe you have to draw your own picture or come up with a picture. So to conclude, the main thing really is organization and having a plan. How are you going to break things down? What does your schedule look like? What are the topics you need to look at more, or you need to maybe take 3 weeks on instead of 1 week? That all depends on you and your strengths and weaknesses, okay? However, even though you're going to prioritize things with your study plan, don't skip anything. Make sure you go through the whole book. Like I said, my best advice to you is to use a book like a Score Builders or Therapy Ed to organize your study schedule and create a schedule based on that. And if you go through that whole book, you should be able to touch everything that you need to, because you don't want to just study MS or just study cardio. You want to make sure you look at every piece of that so that you can have the best chance to answer every question. And then once you start studying, it's all about self-assessment. I get so many students coming back to me and I say, what did you study this week? And they're like, oh, I studied, I don't know, arthrokinematics. And then I ask them a question. Okay, so what's the rule? Okay, so if you are doing flexion of the hip, where is the rule? And I asked them questions like that based on what they were studying, and they're like, oh yeah, well I kind of know, or I remember the rule but I don't know how to apply it and stuff. And then they never ask themselves these questions. That's what I would be doing. I would be asking myself this question. Okay, here's the rule. How do I apply it? Let me try to apply it to every joint. Let me make a chart for every joint of, is it the convex concave rule or concave convex rule, and is the rule going to be up or down? Let me write it for each motion. Can I explain it to somebody? Can I come up with my own example? All of that is what you should be doing to properly study, and then again quiz yourself and make sure you actually know it, or have somebody, could be me, quiz you and then see if you really learned it. If not, you need to go back to it, okay? And that means, again, focusing on your strengths and your weaknesses and being realistic with that, okay? And lastly, when you are doing these assessments, whether on a specific topic or a big mock board, if it's on a specific topic, you should be getting 70 to 80% on a little mini quiz. I would say, going by the standards of our program, 75% or better. If you're doing a mock, anywhere from 65 to 75%, that means you're ready. If you're not getting that, you need to revisit how you're studying and why that's not happening. And hopefully somebody in your life, if you're in my program, me and my faculty can help you with that. Okay, so thank you for listening so much. I think that summarizes it all. And if you're in my program, you know where to find me. If not, you can feel free to reach out to me anyways. My email here is VN as in Nancy, I as in Iceland, E as in Edward, T as in Tom, O as in octopus, hyphen, D as in dog, IAZ. So V Nieto-Diaz at Concord with an E.edu. Thank you so much for listening. Bye.